Public Health England has a very ambitious agenda on mental health. We've been working now for the last 4 years to start establishing strands of work in 3 key areas. The first area that we've taken most action on is on suicide prevention. So we publish guidance, we publish information about local information profiles so that people can get access to the data, and we do a lot of work in terms of promoting local areas having sort of suicide prevention action plans. So there's a whole raft of materials and an ongoing implementation support agenda in suicide prevention. We've just recently published the Prevention Concordat, a suite of 10 documents that helps local areas and national agencies, but particularly local areas, get a handle on the prevention agenda on mental health right across the life course. So we've got JSNA guidance, we've got return on investment guidance, local planning guidance, a whole suite of resources that help local areas with the information, evidence and data they need to take this forward. We'll be going around the country in the next 12 months in a series of masterclasses in 9 regional areas across England. So we are pushing the promotion and prevention agenda quite unashamedly, working with local government, Association of Directors of Public Health, NHS England and a whole set of others in the community and voluntary sector to make sure that happens. The third area that we're doing, which is the subject of today's talk and conversation, was around improving the physical health and well-being and lives of those living and recovering from mental illness. Major program of work for us. So now we've got suicide moving forward and prevention and promotion moving forward. We really need to get this agenda moving forward. So we're doing a lot of collection of data, a lot of analysing where there are mechanisms in the system, like NHS health checks, like physical health checks, like the sequins and the QOFs, to make sure that the inequality that exists in the physical health of people with mental illness, that gap is significantly closed over the next 5-10 years. So a lot to do, a lot of partners to work with, and we can bring a lot to the party in relation to the evidence, production of the evidence, producing guidance, but also very importantly monitoring progress as it happens in those key areas. So the integration of services is more an NHS England area of responsibility, but there's something for the promotion and prevention agenda, which is integrating the work that's happening locally through STPs or through health and wellbeing boards, where each part of the system, whether it's the health system, the social care system, the public health system, the employer system, work around schools, education, housing, that system coming together to see what they can do to promote good mental health, prevent mental health problems and respond to the needs of those living and recovering from mental illness. And I think that kind of system integration goes beyond health and social care integration, although that's a very key part of it. So whilst we rightly have an expectation on our services, whether they're health services or social care services, unless we join up the whole system, we're going to be leaving health and social care to deal with issues that we could have addressed earlier in terms of promotion and prevention, and boosted people's chances of a successful recovery by getting things organised across the system, whether it's schools, employers, universities, colleges and others. So documents tend to be important, but they don't always make things happen. Guidance, evidence, that's all crucially important. The thing that makes things happen is people. And the great thing about today's conference is you've got over 100 people absolutely hungry to do something, whichever perspective they're coming from, whether it's services, children, older people, addictions, perinatal mental health. Everybody needs to be pushing in the same direction. I think part of today's conference enables people to see what the big agendas are now, and very importantly planning for what should be coming next, and working together to make sure these changes that are so desperately needed come about, but also being a voice and a champion for mental health wherever they go, whether they're working in the police service, the health service, local government or voluntary sector organisation. Keeping it real about mental health, what we need to do to promote good mental health, how we need to respond to everyday mental distresses, how we can get to some of the underlying causes of mental illness, adverse childhood events, violence, abuse, bullying, and how we can actually start focusing on solutions rather than the representation of an illness. I think the interaction with the audience and how knowledgeable they are and how insightful they are to some of the problems that need to be addressed, that's the highlight for me. And then the time you build in to have conversations with people at breaks has been absolutely wonderful. I've been meeting people in the education system, the university system, the police system, criminal justice system, the housing system, and people really trying to do as much as they can for mental health. So, you know, the NHS can't be left on their own to deal with mental health and mental illness. This is an all of us agenda, and that's been the really rich part of the conference for me today.